Welcome to The Coalition. This is a talk show dedicated to discussing health, wellness, and inspiration. I'm your host, Dr. Shani Belgrave. Hello, everyone. Welcome to The Coalition. I'm your host, Dr. Shani Belgrave. I am a bariatric and minimally invasive surgeon in Atlanta, Georgia. I'm also the founder of Onika Bariatrics and Wellness. You can get connected with me at www.drshanibelgrave.com. I am super excited to welcome to the show today a renowned rheumatologist, Dr. Mala Kaul. Dr. Kaul joins the show today to share her expertise on autoimmune conditions with an emphasis on lupus. Dr. Mala Kaul, thank you so much for joining the coalition.
Thanks for having me. I'm really excited to be here today.
Thank you so much. So before we get into it, can you please get us started by telling us a little bit about who you are and what you do?
Sure. So I'm a rheumatologist, and I have been for about 20 years, practicing here in Atlanta, Georgia. And a rheumatologist, for some of your listeners, if they're not familiar with what kind of doctor that is, because a lot of people are not familiar with it, a rheumatologist is a specialist for autoimmune diseases. And so examples of autoimmune diseases are things like lupus or rheumatoid arthritis, psoriatic arthritis, Hashimoto's thyroid disease. So there's a whole lot of different kinds of autoimmune diseases, and rheumatologists are basically the doctors who manage those conditions. We also manage other diseases that are not autoimmune, things like osteoporosis, osteoarthritis, or gout. So diseases that are associated with joint problems. So we do a lot of different things.
Awesome. Well, a lot of those conditions that you described are very common, especially arthritis and gout. And so thank you so much for coming on to share your expertise. So can you explain a little bit about what autoimmune conditions are?
Sure. So most people are familiar with the fact that when they get an infection in their body, that their body has a mechanism for getting rid of the infection or getting rid of the virus. And really what that mechanism is are a bunch of cells in the body that are called your immune system. So those cells make up your immune system, and those cells are on constant guard to protect you from outside invaders. Unfortunately, for some patients, though, their immune systems or these cells in their body become dysregulated, and they start to have trouble identifying what is a foreign object and what is their own, a body. And so auto means self, and immune means immune system. So an autoimmune disease is where that immune system, which is supposed to be guarding against external threats, starts attacking self. And so the base, and that's a very simplified way of understanding it, but it's really a dysregulation of cells in the body that are supposed to be protecting us, but when they get dysregulated, they start attacking self. So you can see manifestations of the autoimmune disease in almost any single part of your body because cells circulate all over the place. And so depending on the autoimmune disease, you might see that the disease present itself in your skin as a rash, or in your joint as pain, or is in your lungs as shortness of breath. So autoimmune diseases affect almost any single part of the body. And they're really, although you might see a problem in the joint, it really is stemming from a deeper problem that's happening at the level of cells that are dysregulated.
And so, what is the connection? Meaning, if someone has Hashimoto's, are they at higher risk for having another autoimmune condition? And what is the genetic risk associated with these conditions?
So we can't lump all autoimmune diseases together. There have been some genetic correlations between certain groups of autoimmune diseases, but there is a very wide and vast array of autoimmune diseases. So we do see some things that happen in like clusters. So you mentioned Hashimoto's, for example. Hashimoto's is often can be associated with celiac or with vitiligo. Celiac is a gastrointestinal autoimmune condition. Vitiligo is an autoimmune skin condition where you lose melanin. and Hashimoto's, those can all be together. That's a common trio that sometimes is seen together. But we can see Hashimoto's with lupus or Hashimoto's with rheumatoid arthritis. So it really just depends. But then there's certain conditions you don't usually see together. So again, there is a genetic predisposition. Some of it is understood. We're getting better at understanding the genetic predisposition. But for now, for most patients, if you have an autoimmune disease, it is not uncommon to develop another one. It can happen. And so a rheumatologist is the specialist who's familiar and aware of all the different autoimmune diseases. And so a lot of times being under the care of a rheumatologist when you have an autoimmune disease makes sense because we're monitoring for the development of other things. So it's really not the patient's job to figure that out. They're presenting the doctor their symptoms, and then it's the doctor's job to try to help sort things out, not their Google search, but the doctor.
Yes, absolutely. So my next question was going to be lupus. I'm very interested in this, and I'm curious to hear what you have to say because just from what I remember from seeing in medical school, it seems like things have progressed in a good way with lupus. Can you
Yeah,
kind of give a little bit of information on lupus, who's most affected, and kind of the status of things with the treatment of lupus?
right. So lupus gets a lot of attention, which it should, although it's a very rare autoimmune disease. It's probably one of our rarest autoimmune diseases. But the problem with lupus is it can also be the most severe and organ threatening and life threatening. And so that's the reason that there's a lot of attention. And the other part about lupus is that it generally affects young women in their childbearing ages. So it's severe and it affects young people who should be living their healthy lives. And so I'm super excited to hear and learn and know that I live in a time where we have so many advances for lupus. So like I said, I've been a rheumatologist about 20 years. And when I was training initially as a rheumatology fellow and learning about lupus, our options were so limited. And really, even in the last 5 to 10 years, so as recent in these last 5 to 10 years, there has been I would say an explosion of options, and all of it's been based on really great basic science research that has understood the mechanisms that trigger lupus. And so, whereas even 15 to 20 years ago, we would have to sort of blast patients' immune systems to shut everything down because we didn't know what was the key part of the immune system that was going awry in a patient with lupus. Now we have these really amazing targeted therapies that, because we've identified, well, if your lupus is attacking your kidney, which is a very serious complication because that can lead to dialysis, we now have treatments that aren't going to shut off everything else in your system, but really focus in and treat the kidney and help you get better. So it's fantastic. I mean, when I tell patients that are newly diagnosed with lupus, I said there is no better time to have lupus than now. I mean, obviously we don't want lupus, nobody wants it, but if it happens, I mean, 2025, we have so much hope. There's so much that can be done. But the key is getting hooked in with the right specialist who's keeping up to date with the new treatments, because there are new treatments, and participating in being an active participant in your healthcare, like advocating for yourself and coming to the doctor and making sure you keep your appointments to get the best help that you can.
So, what are some of the signs and symptoms? I know with autoimmune conditions, as you mentioned earlier, they can have a variety of manifestations throughout the body. But what are some of the common symptoms or signs of lupus?
So lupus specifically, the most common symptoms are going to be related to rashes on the skin. And those rashes are usually photosensitive, which means that they are triggered by sun exposure. That's very common. Other common symptoms are hair loss, and the hair loss is not just generalized thinning. A lot of times it might be alopecia, which is patchy hair loss in a patch. Other common symptoms would be joint pains. So you're 20 something years old and all of a sudden your wrist hurts or your knee is hurting when it shouldn't. That would be a potential sign of an autoimmune, particularly lupus. And then those are the most common ones, and fatigue. I mean, I'm hesitant to say fatigue because fatigue is such a common symptom for so many different diseases. But if you're not fatigued, it's unlikely to be lupus. So, I mean, it's very commonly associated with it, but because it's common with a lot of diseases, I wouldn't say that that's the, if you're fatigued, don't think lupus first. It's still a
Right.
very rare disease. And so we need to rule out other things causing the fatigue, but those would be the common ones.
Thank you so much. And then how is this diagnosed? If someone's having these different symptoms, how does one go through a workup, and what are kind of the steps to determining that, yes, in fact, it is lupus?
Yeah. So the tricky part about lupus is that it's not a disease that just turns on and you see every symptom all at once. So many patients, unfortunately, will have a prodrome, meaning a prolonged period of time where they feel a little tired, but they're not really sure what that is, or they might feel a little achy, but not sure. And so, um, and then because I mentioned also these symptoms are symptoms that could be associated with other, conditions. It doesn't have to be lupus. We know that lupus can be delayed in terms of diagnosis, but to say how do we diagnose it, it's a combination of the history. So what are the symptoms the patient's having? And then blood tests and sometimes urine tests. But the blood tests are also something that have to be very carefully interpreted in the context of what's going on, because we don't have perfect blood tests that say, well, if this blood test is positive, this means absolutely you've got lupus. So there are also it's a clinical diagnosis that combines a set of symptoms and a set of blood tests in the right combination, in the right context to be able to call somebody, to say that they have lupus, to diagnose lupus. And the other tricky part, and that's why, it's not as easy as, well, do I have diabetes? And you can just check a blood sugar and or do I have high blood pressure? You check one measurement and with autoimmune diseases, it's a process. And so I say the blood tests and I say the clinical symptoms, but I also say that you need the right assessment by a rheumatologist who's trained in hearing those symptoms and hearing and in interpreting the blood tests in the context of what is going on. And it can take a while. I mean, it can take years sometimes, like we're suspecting lupus, but the other thing is lupus is one of many different autoimmune diseases, and many autoimmune diseases can present with joint pain. So
Right.
we have to kind of monitor the patient. So the most important thing I would say is making sure that a patient who's suspecting that they have something going on, they can start with their primary care doctor. But even if the primary care doctor does blood tests and they are abnormal, they should not, and even if their primary care tells them that they might have lupus, they really should wait before they get worked up with the diagnosis until they've been assessed by a rheumatologist. That's very, very important, because there's and you're familiar with this blood test called an ANA, or an anti-nuclear antibody, and it's a very common screening test, meaning it's done just to kind of cast a net to see if something is autoimmune, but it has to be interpreted in the right context. And so it can be very anxiety provoking for people who are fatigued and have an ANA and think that they automatically have lupus when that is not true. So
I actually have a follow-up question about that.
yeah.
Aren't there other things that can give you an elevated ANA that might be transient, like other conditions or other things that are going on?
Many things.
Mhm.
So a virus can make your ANA go up. We actually know up to 5 to 8% of all people walking around could have a positive ANA and never develop an autoimmune disease. So it can be a normal variant to have a positive ANA. So, it really has to be interpreted. And that was a little clinical, what I just said, but that was for you, Dr. Belgrave. Like, it really has to be interpreted in the context of what's going on. So
Dr. Call, what does ANA stand for?
anti-nuclear antibody. So antibodies are proteins in your blood, And the protein that's present within ANA is against the nucleus. So it's an anti-nuclear antibody. So it's a protein against the nucleus. It actually is not believed to be pathogenic. Again, I'm getting technical. That means that the ANA is not causing disease in a patient. It's just something that's identified in people who have autoimmune diseases. So there are more specific lupus blood tests, like a double-stranded DNA, a Smith antibody, complements like C3, C4. These are different, those complements are components of the immune system that can be tested. The Smith and the double-stranded DNA are different types of antibodies. Again, those are proteins made by your body when you have lupus. And so again, they have to be interpreted correctly. But the key is, a lot of times if you see the rheumatologist, we're going to know that something is going on based on the constellation of symptoms, and follow along to intervene when's necessary.
The alopecia associated with lupus, is that reversible with treatment?
So even in alopecia, there's several different kinds of alopecia. It can be reversible. It depends on how long it's been going on, whether it's the subtype that's scarring. It just depends on the patient. And that's the other thing that I tell people when we're talking about lupus specifically, is that it's very hard to make generalizations about lupus. We've basically, we meaning medicine, the medical community, has labeled probably 150 or more diseases as lupus. I actually believe that lupus is it's not the same disease. So what I mean by that is, we will call somebody who has a little bit of hair loss, a positive ANA, joint pain, and a low white blood cell count, for example. They could meet clinical criteria for lupus. And yet, on the other end of the spectrum, there could be a patient who has a positive ANA and is having severe kidney inflammation, is about to be on dialysis with no platelets, and we call that lupus too. That can't all be the same. There are different pathways and different processes going on that we've just not been able to subtype, and we're getting better. We have been able to identify certain categories, and so it's getting better, and we're understanding more about it, but we've kind of lumped everything in the term lupus. So again, the other reason to see a specialist is because if you're on that milder end of the spectrum and we're calling it lupus, that does not mean that you're going to progress to the scary lupus. Could you? Possibly, and that's why you have to be continually monitored, but it's not essential that that happens. So, and those who present with very severe disease from the onset, they may have a very severe episode of their disease, and then it calms down and it burns out, and then they don't have ongoing symptoms. So again, these are not all one disease. Like, calling it lupus is a very simplified oversimplification of what is going on. These are different variants of the immune system presenting in different ways, but there are patterns. And again, just, the more you see it, the more you recognize it. But it is more common in women. It's more common in women of childbearing age. It's more common and unfortunately more severe in women of color. African American, Hispanics can have more severe disease. And so for all these reasons, I think, especially patients who have family history of autoimmune diseases need to be on high alert.
Well, thank you so much, Dr. Mala Kaul. You answered all the things that I always wonder about lupus.
Okay.
And I'm sure it'll be helpful to our viewers. What is the best way for people to connect with you?
So I've just opened up a new practice. Like I said, I've been practicing 20 years, but I've opened up my new dream practice to take care of patients with autoimmune diseases. They can find me at myintegrahealth.com or on Instagram Integra Health MD is my handle on Instagram. So folks can find me either way. And I really appreciate the opportunity to be here and share a little bit about autoimmune diseases with your group.
Thank you. And as you stated, there are many different conditions that you treat. And so you have an open invitation to return to tackle another topic. We'll see you next time.
Thanks.
Well, everybody, thank you so much for tuning in for another impactful episode of The Coalition. I'm your host, Dr. Shani Belgrave. You can stay connected with me at www.drshanibelgrave.com. Very special thank you to Dr. Marla Kaul, accomplished rheumatologist and founder of Integra Health. You can get connected with Dr. Kaul through her website or on Instagram. Thanks for watching. Make sure you share this episode with friends and family to raise awareness and understanding about autoimmune conditions and lupus. I'll see you next time.